Bismillah, Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, let me introduce myself. My name is Hana Salonur Sabrina, and two of my partner, Nadia Budi and Keisha Berlian. So here, we will present about Alzheimer's. At this presentation, we are raising the title is Fight Alzheimer's with the support of family and people around us, which will explain what Alzheimer's is, the new condition of Alzheimer's. Then we will also explain the symptoms and causes. And the last thing, we will tell you how to treat those with Alzheimer's. Well, before coming into the presentation, I would like to thank the lecturer and the friends who saw our presentation today. Let's just get to the point, where Nadia Budi would like to go first. Please, for Nadia Budi.
Thank you, Hannah. I'm Nadia Budi Sartika, so let's moving on. All right, talk about Alzheimer. So what is Alzheimer? Alzheimer these days is the most common type of dementia. Did you know about dementia before? Dementia is a syndrome brain disease, though usually of a chronic nature of a progressive and there is interference function. This syndrome occurs in disease Alzheimer's, in cerebrovascular disease, and in other conditions that are primary or secondary to the brain. Alzheimer is a progressive disease beginning with a mild memory loss and possibly leading to loss of the ability to carry on a conversation and respond to the environment. So, Alzheimer disease involves part of the brain that controls talk, memory, and language. The brain cell of the memory connection and the cell themselves degenerate and die, eventually destroying memory and other important mental function. Memory loss and confusion are main symptoms. No cure exists, but medication and management strategies may temporarily improve the symptoms. And we talk about current situation of the Alzheimer. Then, how the spread of this disease through the world, especially in Indonesia, is it a lot? No. Alzheimer disease (AD) is recognized by the World Health Organization as a global public health priority. So, did you know Alzheimer report the first case in 1907 and there are still no disease-modifying treatment? So, in Indonesia, how about Indonesia? In Indonesia, it is estimated that there are around 1.2 million people with dementia in 2016, which will increase to 2 million in 2030 and 4 million people in 2050. So, we throw back again in 2016, dementia estimated to have a cost of 880 USD billion for a year and is predicted that increase to 1 trillion USD in 2018 and 2 trillion USD in 2030. So, of all patients with dementia, which is 50 until 60% of them suffer from the most common type of dementia diagnosed with dementia of Alzheimer's type. Alzheimer's dementia risk factor, the most important are age, family history, and genetic. Genetic play an important role in increased risk factor of dementia. Dementia Alzheimer, where there are two types of genes that play a role in the development of Alzheimer. The first one is the risk genes, and the second one is determinant genes. So, our goal in making this video and this presentation about health promotion are the information about Alzheimer's still does not. So, our goal in making this video and this presentation about health promotion talk about Alzheimer are information about Alzheimer's still does not reach all level of society. This is shown by the large number of people who have not reported their condition due to the lack of information about the signs and symptoms of Alzheimer's. Information regarding the signs, symptoms, treatment, and the care of the family. The care of the family with Alzheimer is very important to provide to provide the community to provide the community. In addition to counseling, the delivery of the information can be done through and the medium of a film with Alzheimer's themes. So, our goal in making this video and this presentation about health promotion to talk about Alzheimer's are information about Alzheimer's still does not reach all level of society. This is found by the large number of people who have not reported their condition due to the lack of information about the signs and symptoms of Alzheimer's. Information regarding symptoms, treatment, and the care of family is the most important. The care of the families with Alzheimer's is important. It's important to provide to the community. In addition to counseling and the delivery of this information can be done through to the medium of film with Alzheimer's themes like Still Alice and the other one.
Hello, my name is Kesha Berlian. Thank you for Hannah and Nadia. Here I will explaining about symptoms and causes about Alzheimer. Number one is causes. Factors causing Alzheimer disease. Age is the most important factor for Alzheimer disease. After a person reaches the age of the 65 years, the risk of getting Alzheimer will increase to twice every 5 years. About half of people aged 85 years have Alzheimer. But people who experience a rare genetic change often develop Alzheimer disease and start showing symptoms of this disease in their 50s or 60s. Number two is family. Family history and genetic. Number one, the risk of Alzheimer will increase if there are close family members like parents, brother, sister, children suffering from this disease. Number two is scientists have identified change or mutations in three genes that are responsible for the emergence of Alzheimer disease. Number three, about family, research found that the gene that is the strongest risk in Alzheimer is apolipoprotein E4. Number three is gender. Women have a greater risk than men of developing Alzheimer disease. This is because most women have a longer life expectancy than men. Number four is lifestyle and heart health. Until now, there is no strong evidence that lifestyle change can reduce the risk of developing Alzheimer disease. Number two is symptom. Symptom about Alzheimer. Number one is memory loss, difficulty remembering or losing things. Number two is depression. Number three is dyspepsia or aphasia. Number four is psychotic symptoms or like hallucination and delusions. Number five is dyspraxia or apraxia. Number six is behavioral disturbance, like physically and verbally abusive, hyperactive, unable to cooperate, walking here and there, doing repetitive things, and excited. Number seven is disorientation about time, place, not knowing family, friends, and herself. Number eight is disturbance in decisions making and problem solving. Okay, next, therapeutic. Number one is objective. The main objective of Alzheimer treatment is to maintain the patient cognitive function for as long as possible. Number two, the secondary objective is to treat physiatric and behavioral sequelae that occur as a result and disease. Number two is makeup, improving the normal functioning of the patient. Number two is prevent of development of the disease. And number three is prevent unwanted distraction or behavior. Strategies. Number one is pharmacology. Strategies. Number one is pharmacology. Pharmacology divided into two. Number one is cognitive. Cognitive, the cure is for inhibitor cholinesterase, antagonist receptor NMDA, and non-conventional. Number two, in non-cognitive, the cure is for antipsychosis and antidepressant. Number two is non-pharmacology. Non-pharmacological therapy involves the patient, family, or caregiver to support, deal with, and understand the patient condition. The life of a patient with Alzheimer's disease must become increasingly simpler, structured, and the patient family needs to be prepared for the change in the life that will occur as the disease progresses. Reducing brain function. and brain gymnastic, physical exercise, and setting healthy food patterns or menu are highly recommended to avoid the emergence of Alzheimer's disease. Non-pharmacological therapy is carried out to reduce behavioral problems and mood disorders in people with Alzheimer's. Alzheimer's disease prevention. Alzheimer's disease cannot be treated, but it can be prevented. Here is how to prevent Alzheimer's disease. Number one is consume healthy food. Recent research on Alzheimer and dementia in the Journal of the Alzheimer Association found that people who consume adequate amounts of folic acid have a much lower risk of developing Alzheimer's disease. Number two, apply a healthy lifestyle according to the American Alzheimer Association, avoiding smoking and alcohol consumption. Exercise and being active in social life are related to brain health. Number three is exercise your body. Regular exercise is important for your brain health, walking 45 minutes 3 times a week for 6 months. Significantly improve the mental ability for adults without dementia. Number four is exercise your mind in a 7-year study of 118 adults trained found that having free time lowered the risk of developing Alzheimer. This is free time includes visiting friends, playing cards, watching movie, solving puzzle, playing chess, reading, listening to lecture or lectures, volunteering, and pursuing our position. The key is to use your brain all the time. Avoid health injuries research has found a strong link between severe health injuries and Alzheimer's. You can reduce that risk by wearing a seatbelt, driving car, wearing a helmet when riding motorcycle, and by minimizing the dangers around you. So that was some symptom causes and therapeutic. I hope I have explained it clearly and you can understand it.
Okay, hello everyone. Moving to me again. In this slide, I will tell you about Alzheimer's factor. Okay, the first factor Alzheimer is August D. The story starts in last November 91 at a clinic in Frankfurt, Germany. A young psychiatrist was confronted with a weird case that had never been documented before. The woman patient was 51 years old and her name is August D. Was brought to the clinic by her family on November 25, 1901. In her first meeting with the August, in psychiatrist's first meeting with the August D, patient at a clinic in Frankfurt, Alzheimer's, was made to wonder. He decided to take the case carefully. On November 26, he wrote about August D that the woman sat upon her bed with an expression of helplessness. All Alzheimer's questioned whether it was a girl's name on her family name were answered with August. So are other questions. What is your husband's name? Asked the Alzheimer's doctor. That is fine. August, I think, answered August D. When they first entered the clinic, their behavior is dominated by complete helplessness. She was confused about time and place sometimes. She said that she understood nothing and didn't know where to go. Sometimes she is delirious and carries around the part about the bed, calls her husband and doctor, and experiences auditory hallucinations. Often she screamed in an eerie voice for hours, brought Alzheimer's note. Okay, and then next to the two story about Alzheimer's factor is in Still Alice movie. You know, right? Still Alice movie. That is very what we call very terkenal, uh, very famous at the time. Gitu. Okay, so Alice movie is the movie that got multiple award-winning film. Still Alice brings the issue of early onset dementia to the forefront. This real-life story about how Alice Howland, a linguistic professor at Columbia, and her family deal with her diagnosis of familial Alzheimer's disease at age 50 is both heartfelt and powerful. Watching the film is the first time many people get to see close up what it's like to be an Alzheimer's patient. as well as a caregiver. Alzheimer's disease, the condition that Alice is eventually diagnosed with, is the most common cause of dementia. Alzheimer's is a progressive disease that disrupts typical cell function in the brain. The leading theory is that in the case of Alzheimer's, plaques and tangles, abnormal deposits and fibers build up in the brain causing brain cell dysfunction and resulting cell death. This is the most likely cause of the symptoms of dementia described above. Okay, and then next to the last story is William, William Buntoro. During the one TV program, William told that he never thought he would become an Alzheimer's. Although while still actively working as a private employee, William often admitted that he had forgotten things. However, William viewed this like normal forgetfulness because he was tired of his work. William said, I talk about the time because I had so much to remember every day that I forgot a few things, says William. Opening his notes, he never thought of checking in with the doctor either. After all, according to William, forgetting is both natural and human. Sometimes it overlaps. I think once in a while I'll forget what day or file this is. It's natural, he said. Okay, guys, just that the story of Alzheimer's factor that I can tell to you. After we know about this three story Alzheimer's factor, we can realize and also know the symptoms. So we must be aware with Alzheimer's disease. Okay, guys, I think that's all for our presentation. Thank you so much for your attention. And I want to say very sorry. I'm so sorry about the fault and anything. Wassalamualaikum warahmatullahi wabarakatuh. Oh yeah, before that, I'm forget. Oh my god, I'm forget. Okay, there is some quotes here. We can. This is quotes from Still Alice movie. She thought here, just because I will forget it some tomorrow doesn't mean that I did not live every second of it today. So Alzheimer people is not like a crazy people, right? We know from this presentation, we know like Alzheimer disease is some disease, gitu. Some disease like that, not like crazy people. So we must be aware and we must care about Alzheimer's patient. Thank you so much. Bye guys. See you in the next presentation. Assalamualaikum warahmatullahi wabarakatuh.